know, talking about snoring here, and we're also talking about sleep apnea and any kind of sleep disorders you might have. We've got our next caller is Prudence. Hi, Prudence.
Oh, hi. Hello.
Hi there. Tell us about your problem.
Yes, I've been going to bed late for the past 4 months, consistently. I'm wondering...
Speak up, please. Prudence, we can't hear you.
Yes, I've been going to bed late at night for at least 3, 4 in the morning for the past 4 months. And I'm wondering if taking any sleeping pills, would that be of any danger? Would it shock the system or create any imbalance in the brain or any such? Because
okay, so you can't fall asleep. You can't fall asleep until 3 or 4 in the morning? Is that what you're saying?
I always find it difficult to find falling asleep from ever since I was a child. And for the past 6 months or more than 4 months, I should say, I've been going to bed, very late, and it's getting too much out of hand, and I'm wondering, how can I deal with that?
Okay, good question.
Well, obviously, if you are reporting sleep problems ever since you were a child, then you have had a problem for a very long time, and it would have been a good idea to have sought help much earlier. And as the condition now appears to be deteriorating, which frequently happens, I think you should go and speak to your family physician, get your sleep problem assessed, maybe you need to look into areas of stress, your sleep habits, any other related medical or...
Would you go right to the pills?
No, I wouldn't.
No.
I would definitely, you need to rule out and you need to find the underlying cause, because sleeping pills, although they are used, they can mask a problem.
Okay, and it's interesting, she brings up a good point about sleep disorders in children. There's a sleep disorders clinic at Sick Kids.
Absolutely.
There are children with sleep disorders, and one of our things as parents is we have to teach our kids how to fall asleep on their own as babies.
Absolutely. Sleep disorders are common in children. Sleep disorders are hereditary, and they are inherited from parents. Lots of sleep problems affect kids, and a fair number of kids who are hyperactive and are labeled as attention deficit or behaviorally disturbed have an underlying sleep disorder, and a fair number of them, in fact, have sleep apnea or sleep disorder breathing, and they could benefit significantly from a simple procedure like taking their tonsils or adenoids out.
Okay. All right. Well, thanks for that question, Prudence. And we have another email that's arrived here, and it's from the night creature. Are there such things as night owls? This person can't fall, Lulu, she can't fall asleep but before 3 or 3:30 every night, and it's causing me to wake up late. She's usually very alert after midnight. Can she do some breathing to change her sleep habits? Any breathing techniques?
I think that you'd have to look at somebody, see what they're doing as far as their sleep hygiene, and see what they're doing before bed. Caffeine, that type of thing, that might be stimulating them. Do you agree, Dr. Awad?
Yeah.
Okay, so there isn't such thing as a night owl? Aren't there morning people and night people?
Morning people and night people, there is definitely a tendency for some people to go to bed early and wake up early and feel it first thing in the morning, and for some people to want to go to bed somewhat later and sleep in. However, if you are talking about maybe 1 to 2 hours, depending on your work schedule, it is manageable. But when you are talking about somebody going to bed at 3 or 4, she is definitely from the kind of...
It's affecting the rest of her life.
And also, she will be fitting under a criteria of what we call delayed sleep phase syndrome, and it requires medical attention and proper diagnosis and intervention.
Okay, I hope you heard that, Lulu. We've got Ike next on the line. Hello, Ike.
Yeah, I have a question.
Go right ahead.
I'm 64 years old, and I snore quite a bit. Is there any surgical procedure that can be done so that my upper plate in my throat could be fixed?
Depending on surgery is one of the options for treatment of sleep apnea and for snoring. But a proper diagnosis, first of all, needs to be made, because if you have a mild sleep apnea and you have excessive tissue at the back of your throat, you have big tonsils, you have evidence of physical obstruction, surgery definitely will be a very, very good option. And
is that covered by OHIP?
This kind of surgery is.
Okay.
And it can provide cure. However, if you are diagnosed with severe sleep apnea.
You need to wear one of these
you
puppies.
definitely need to, and that will take care of your snoring and will make you feel much better. Yeah.
Is your wife being driven nuts by this snoring, Ike?
Oh, yes. I've used the CPAP pump, and it's very awkward to use at night. Every time I turn, it comes out, and, you know, it leaves a mark in my nose and throat or in my lips. It's very hard.
How long have you used it for and when? How long ago?
Oh, I used it for a year and a half, 2 years ago, and I gave up because it's just not comfortable.
That's what I said. You can't sleep with this thing.
Most people, 95% of people sleep with CPAP and get used to it and comfortable. I may be one of the fewer people who have had a problem. And definitely I would say a year and a half of compliance and perseverance with CPAP is long enough. You should go back to your sleep doctor and explain the situation to them and get a referral to see an ear, nose, and throat surgeon.
Okay, and they can look at your throat.
Which we do regularly, and then they can advise you with an expert opinion on the appropriateness of surgery and the chances of success.
And also keep in mind is that the masks that we use on CPAP patients have really changed in the last 2 years. They've gotten a lot better, a lot more comfortable. Not as much pressure needs to be placed on the mask in order to get a good
so
seal.
Maybe he could
even going back to
Did your mask look like this?
No, it's kind of different.
Yeah.
Okay, so this is the newer model.
In the last 2 years, it's been a huge difference.
But the bottom one that I'm seeing on the screen is similar, and you know, it's kind of phobia that you get, that you are somewhere that you don't want to be.
Yeah, because it kind of claustrophobic on your nose.
Yeah, that's true.
There's other types of masks out there that don't go around your nose, but go sort of around the outside of your nostrils.
Sort of like an oxygen machine or something.
Well, just a different application, and it's so it'd be best to go back. Go back to the
Don't give up, Ike, because
don't give up, Ike.
Don't give up. It's a serious disorder. And
think about your wife.
Yeah, there are help available there, and go and seek it.
Okay, we have to take a short break here on this health edition of Talk TV. We'll take more of your calls on sleep when we come back.